I'm Joe Graydon.
And I'm Terry Graydon. Welcome to this podcast of the People's Pharmacy.
You can find previous podcasts and more information on a range of health topics at peoplespharmacy.com. Is it possible to integrate conventional cancer treatments such as chemotherapy and radiation with holistic approaches? This is the People's Pharmacy with Terry and Joe Graydon.
Dr. Timothy McCall is board certified in internal medicine. He's also an internationally recognized yoga teacher and a student of Ayurvedic medicine. When Dr. McCall was diagnosed with neck cancer in 2016, he opted to integrate the best of both worlds.
How did his Western-trained oncologist react to Dr. McCall's desire to include yoga and Ayurvedic medicine in his treatment program?
Can his holistic approach help people with other challenging medical conditions?
Coming up on the People's Pharmacy, a doctor's east-west journey through cancer.
Welcome to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon.
Today we're talking with a physician about his experience with neck cancer. Dr. Timothy McCall has devoted years to learning and teaching yoga. He's also studied Ayurvedic medicine, the traditional healing practices of India. How did that affect his decisions about treatment strategy when he was diagnosed with oropharyngeal squamous cell cancer that had spread to his lymph nodes?
Dr. Timothy McCall is a board-certified internist. He's been Yoga Journal's medical editor since 2002. His books include Examining Your Doctor, A Patient's Guide to Avoiding Harmful Medical Care, Yoga as Medicine, and his latest, Saving My Neck, a doctor's east-west journey through cancer. He teaches yoga therapy seminars in the U.S. and around the world.
Welcome back to the People's Pharmacy, Dr. Timothy McCall.
Thank you. It's wonderful to be back.
Dr. Timothy McCall, when you were last on our show, we spoke about your book, Yoga as Medicine. How long ago was that?
That book came out in 2007, so I guess that would have been about 12 years ago.
That was an amazing book and an amazing journey because you are classically trained medical doctor, and then you kind of became renowned as a doctor who is passionate about yoga. Just briefly remind our listeners how that happened.
Well, you may not remember this, but I was on your show a third time when my first book, Examining Your Doctor, came out in 1995.
I do. That was quite an amazing book in itself.
Thank you very much. And that was the year I started to practice yoga. And, I had an interest in alternative medicine for many years. But one of the things about being in medical school and residency training and the practice of medicine is that you have no time. They don't teach you about it in the regular curriculum. They monopolize your time, so it's hard to do it on your own, and so mostly you don't learn about it. And when I finished that book, Examining Your Doctor, I decided now's when I'm going to jump into trying to learn about alternative healing. I simultaneously, not because of health reasons, decided to investigate yoga. A couple of years after that, I'd become very frustrated with the practice of medicine as the kind of corporate-driven managed care came into the state of Massachusetts where I was living at the time. And I felt like Lucy at the chocolate factory, trying to see patients quickly and increase throughput and all that kind of corporate language that was common at the time. And I decided to stop practicing medicine and just write because my writing career was going pretty well. But I missed having a foot in the real world. And it occurred to me several months later, why didn't I take this hobby, yoga, that I seem to love and seems to have health implications, why don't I make this my foot in the real world? Why don't I start to investigate what the health consequences of yoga are? That's what I did.
Well, it was an amazing book, and it introduced our listeners to yoga from a perspective that they may never have realized before. Since that book and since your journey into the world of yoga as medicine, you've experienced some health issues of your own, and that has led to your new book. I love the pun, Saving My Neck, A Doctor's East-West Journey Through Cancer. Please tell us about, first of all, how you were diagnosed and then what happened.
Well, I found the cancer myself. So I had a HPV-related tonsil cancer that had spread to lymph nodes in my neck. And essentially, one of the practices that I do every day, which comes out of Ayurveda, which is the traditional Indian system of holistic medicine, which is often goes hand in hand with yoga, is to scrape your tongue every day. And I did that every morning, and it's not normal to have too much coating on the tongue. Now, in the past, I'd had it for a day or two, but then it would always go away. But I had it for several weeks straight, and this made me wonder what the heck is going on. So I got a flashlight and went to the bathroom and looked in the mirror. And, I've seen tens of thousands of enlarged tonsils in my career practicing medicine, but I never saw only one enlarged and the other one normal. And that's what I spotted in myself. One was enlarged to maybe the size of a dime, not very big. But as is common in this kind of head and neck cancer, by the time you notice anything, it's already spread, metastasized to the lymph nodes, which was what had happened to me. So that was how I spotted it. It's a little bit more convoluted story than that, but that's a good enough shorthand, I think.
That must have come as a huge shock to you. When you hear the diagnosis, because obviously you saw something, you went to a specialist, they figured out, oh yeah, there's something going on here, and the word is cancer. How did you react?
Well, first of all, I should say that when I was practicing medicine, ending in the late 1990s, this diagnosis of tonsillar cancer caused by HPV wasn't on the map. I never saw a patient my entire career who had it. I saw two different primary care doctors who didn't know what it was. I didn't know what it was. I have a friend who's a dentist who prides himself on screening his patients for oral cancer. He had never heard of tonsillar cancer. So this turns out to be something that is now increasing greatly, but it was not recognized by people. I didn't know what it was right away. So it actually took me a couple of months to get to that point. But when I did get to that point, when I finally went to see an ear, nose, and throat doctor who had an intuition right away, and as soon as I heard his intuition, I knew it was correct, that it was cancer. Yeah, and of course, metastatic cancer at that. So I was shocked, and I definitely went through a period before I started to do some research that learned that this particular one, at least in the short term, seems to have a quite good prognosis, that it wasn't as bleak as I think I feared when I first got the diagnosis or first suspected the diagnosis. But yeah, I think I did the same thing that a lot of other people do. You kind of go into shock. You kind of think like, oh my God, I might not be around that long.
Now, you actually did something that most other people wouldn't think of doing. Before you started your treatment, you went to India. Now, part of the reason you went to India, you already had relationships there because you've been studying yoga for so long. You've been there before, you know people. But why would you take time out before the treatment to go to India and do what you did? And I hope that you will tell us what you did.
Sure. So I also, in addition to yoga, I also study Ayurveda, and I've been studying it in Kerala, which is the state at the southwest tip of India. I've been studying Ayurveda there for about a dozen years. And so I had a lot of faith and a lot of connections there. But part of it just had to do with the vagaries of the U.S. healthcare system. My tonsillar cancer was diagnosed in New York. I decided where I was living in New York, which was rural New York, and it was not going to be the best place for me to get treated. I didn't have as many family connections. I wasn't confident that the health care in that particular area was going to be as high a quality as I was looking for. So I decided to go to the Southeast United States to an institution that's quite famous where my brother was on the faculty. And I thought, he's an empty nester. I could go live with him very close to the cancer center, rural class place. I figured that would be where I would need to go. But I was diagnosed just a couple of days before Thanksgiving, and there was no way I could change my health insurance to that state until the first of the year. Just because of the way our healthcare system works, my health insurance wouldn't cover me there. So I suddenly found myself with just a couple of days warning with a month on my hand that I wasn't expecting. So I figured, what the heck? Let's go to India. Let me get some Ayurvedic treatments to balance me, to strengthen me, to put me in the best condition to be able to undergo the heavy-duty stuff that's about to happen with chemotherapy and radiation and all of that. Now, when I did this, I thought about something I was taught in medical school, which is that cancer is potentially life-threatening, but usually it's not an emergency. There's no rush to treat most cancers. Now, sometimes a cancer is growing in a critical place, compromising the spinal cord or some important blood vessel, and then you really do need to deal with it on an emergency basis. But most of the time, by the time it's been diagnosed, it's been in your body for 5 years, 10 years, 15 years, maybe 20 years. So the idea that a few weeks delay is going to be critical generally doesn't make a lot of sense. I figured it was more important to be in good shape and more important to have time to do the research to make the correct decisions rather than do what I've heard so many patients say over the years. I want this thing out of me as soon as possible.
You're listening to Dr. Timothy McCall. He's a board-certified internist who has been Yoga Journal's medical editor since 2002. His books include Examining Your Doctor, A Patient's Guide to Avoiding Harmful Medical Care, Yoga as Medicine, and his latest, Saving My Neck, A Doctor's East-West Journey Through Cancer. He teaches yoga therapy seminars in the U.S. and around the world.
And Terry, human papillomavirus, HPV, it's much more common these days.
It has become very common, and it is associated with the type of cancer that Dr. McCall had.
After the break, we're going to find out what happened to Dr. McCall when he went to India.
How did he decide which Ayurvedic modalities to include in his treatment?
And then once he got back to the United States, what happened at the cancer center?
Well, Dr. McCall developed a special relationship with his radiation oncologist.
Should we all consider combining conventional and alternative therapies when we're faced with a health crisis?
You're listening to The People's Pharmacy with Joe and Terry Graydon.
The People's Pharmacy podcast is sponsored in part by Kaya Biotics. KAYA Biotics offers the first probiotics which are both certified organic and hypoallergenic.
All probiotics are produced in Germany under laboratory conditions with high-quality ingredients and under strict regulatory oversight.
The 3 available formulas are created for very specific purposes, such as strengthening the immune system, fighting yeast infections, and helping with weight loss.
To learn more about Kaya Biotics probiotics and the important topic of gut health, you can visit their website, KayaBiotics.com. That's KAYA Biotics.com. Use the discount code PEOPLE for $10 off your first purchase. Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. If you would like to purchase a CD of this show, you can call 800-732-2334. Today's show is number 1175. The number again, 800-732-2334, or visit our website. It's peoplespharmacy.com. You can also download the free podcast from our website or wherever you get your podcasts.
The People's Pharmacy is brought to you in part by Verizana, an analytical laboratory providing home health tests for hormones, gut health, and the microbiome. Online at verisana.com.
Today our topic is integrating conventional cancer treatment with alternative therapies such as yoga and Ayurvedic medicine.
We're talking with Dr. Timothy McCall. He's a board-certified internist who has been Yoga Journal's medical editor since 2002. His books include Yoga as Medicine and his latest, Saving My Neck, a doctor's east-west journey through cancer.
Dr. Tim McCall, you decided, okay, I don't have to do anything immediately. I can wait a couple of weeks. I'll go to India. I'll make my body as strong as possible using Ayurvedic principles. What happened when you got there?
Well, essentially, I just had the same treatments that I've had many times before, basically massage using medicated oils, medicated meaning various herbs have been infused into the oils, and other standard techniques in Ayurveda. Now, I should mention that there's more than one school of Ayurveda, and the Ayurveda practiced in Kerala is a little different than what you might read about in books that you'll get in the United States, for example. But I had these treatments, just rested, kind of had a retreat, did a lot of yoga. I read a ton of books and articles on cancer and my particular cancer to try to be prepared to make good decisions once I got to where I was going to be treated.
How did you decide which Ayurvedic modalities to include in your treatment?
Well, Ayurveda is basically mostly about lifestyle and diet and chronobiology, trying to align your personal body rhythms with the rhythms of nature. For example, getting up fairly early in the day, eating your last meal before sunset. So a lot of lifestyle stuff is part of Ayurveda. And then I didn't so much make the Ayurvedic decisions. I had an Ayurvedic physician, an elderly man who has actually died in the last couple of years, but who was there at the time, who advised me on what to do, and I simply followed his recommendations, and we did kind of standard treatment. There was some concern on their part that they boil the oils and they dip these satchels of herbs and things into them, and then they use that to massage you. They were afraid that the heat from the massage could potentially cause the cancer to spread. So when they did my neck where the metastatic lymph nodes were, they were very gentle and they barely rubbed it. But other than that, it was just a standard treatment of the kind I've had many times before, not designed to treat my cancer. Like all good holistic treatments, designed to treat me, to make me stronger and more balanced, with the idea that if I'm stronger and more balanced, I'll be in better position to fight the cancer.
How well did it work in the sense of, you went still, I suspect, in a state of shock, still dealing with the diagnosis, getting ready for conventional treatment. But here you are in India for what, a couple of weeks?
Almost a month, actually.
At the end of that time, how are you feeling, especially emotionally?
Well, part of my probably area of psychology that I've needed to address is that maybe I didn't do all my emotional work. Maybe I kind of just got into busy mode and took care of myself and made decisions. So I have to say that I did not do a whole lot of emotional work or grieving or any of that. That stuff came a little bit later, and I talk about that in the book. At that point, I kind of did, I think, what a lot of guys would do, which is get busy and do things to try to help myself and kind of on some level without even consciously thinking about it, not think about all the emotional ramifications of what's going on.
So now you're back in this country. You're at a major cancer center, one of the leading ones in the country. What happened next?
Well, I then needed to start to interact with my physicians and meet them, first of all, because I hadn't met any of them before. And I, so I had a radiation oncologist. I had a regular oncologist. I had an ear, nose, and throat surgeon who I was referred to and who, in fact, recommended surgery to me, although I opted not to have that surgery. And the interesting thing was that we mentioned earlier, my first book, Examining Your Doctor, was teaching people how to be assertive patients to be sure that the healthcare they got reflected their values. And I suddenly found myself this time having to live out all these lessons, this time not as an advisor, but as the patient.
That's a lot harder, isn't it?
It is harder, but I think my personality is strong enough, and I have enough conviction of my ideas that I'm a very polite patient. I'm very respectful, but I'm tough. I don't do anything I don't want to do. And even though theoretically the doctors run the show, I ran the show the whole time, and I used my doctors as advisors and, of course, had to negotiate with them and all of that. But I very much made the decisions, for example, opting not have the surgery that the surgeon very strongly recommended. I thought it was I felt that the medical evidence was not strong that surgery would improve my likelihood of survival at all compared to radiation, which is the main treatment, and chemotherapy, which is just an adjunct to radiation, essentially, for this cancer.
Well, let's talk for a moment about your radiation oncologist, because he was kind of an interesting physician, and he paid a lot of attention to your wishes. He actually adjusted the dose of radiation to accommodate, something that you were aware of, and I was rather impressed with that relationship.
I think he was an amazing physician. He really was. I'm so used to, because he's kind of an academic superstar, kind of rising star in academic medicine, and I'm so used to doctors like that kind of having personalities like bulldogs. And this guy was such a human being. He was so warm. He really informed me well. He treated me some combination of being a colleague and a patient. And he involved me in decisions. We negotiated what was going to be the best path forward. And I ended up taking more treatment than I thought I was going to take. And I ended up getting a little less than he normally gives. But we got to a place where we both were happy with that.
Now, let's be honest. Radiation treatment is not easy. And you came up with a kind of interesting antidote to some of the skin reactions, the turmeric cream. So can you give us a little insight, please? Sure. So, one of the things I was trying to do was, in the face of this very potent conventional medical care with a lot of side effects, chemotherapy and radiation, to do everything I could using safe, holistic measures to try to mitigate the damage. And so one of the side effects I got quite badly was a radiation dermatitis, a skin rash, very nasty skin rash on my lower face and neck. And I tried various creams, aloe vera, arnica, other things with really negligible effect. And then I tried one I had brought back from India, which is a simple over-the-counter turmeric cream in a sandalwood oil base, Vico turmeric cream, that I just bought in a drugstore in India. And it was kind of like magic. And the thing about radiation is that the side effects progress the longer you stay with the treatment. And, so a couple of weeks into the treatment, I'm already starting to get this rash pretty bad. I've got 3 or 4 more weeks of treatment to undergo.
And what's supposed to happen is that the skin rash is only going to get worse over the next weeks because you have the ongoing and cumulative assault of the radiation therapy. And I should mention that the radiation therapy that they give, recommended rather, 70 gray, is the equivalent of 700,000 chest x-rays. 700,000. So my skin didn't like that. And the turmeric cream, miraculously, in the face of the ongoing assault, my rash started to get better. And one day I went into the radiation therapy session, and the technician said to me, "What are you doing to your neck?" And I thought, oh my goodness, am I doing something wrong? She wanted to know why my rash was getting better in the face of ongoing treatment. And she wanted to know the name of the cream, and she wanted to write it down because she wanted to use it for something that she had that was not related to radiation.
I would have guessed that she might have wanted to be able to refer other patients to this cream since it was working so well for you.
Well, the interesting thing is that would not be something a technician would generally do. That would be left to the doctors. So people have their different roles, and I think the technicians are not supposed to make that kind of thing. But the interesting kind of thing was that even in the face of my dramatic improvement in my skin rash, in the face of the ongoing radiation, none of my doctors seemed to be the least bit interested in what it was I was doing. And the idea that might be helpful with their patients, other patients never seemed to cross their mind. And of course, what I was doing is an unproven thing. And all I had was an anecdote. But it was a pretty impressive anecdote. I have an epigraph in one of the chapters of the book that from Thoreau that says, "Some circumstantial evidence is stronger than others, as when you find a trout in the milk."
I'm not quite sure what you're supposed to conclude from trout in the milk, except that the milk perhaps has been adulterated.
He launched that quotation during a time when farmers were intentionally diluting their milk and selling it.
Yeah.
So your guess was right on.
Now, Dr. McCall, I think that a lot of our listeners are aware that there seem to be two camps. And like so much else in our society, they often are very polarized. So you've got the camp of the conventional medical doctors, your excellent doctors who did a great job, but were not at all interested in the other things you were doing. And you've got the camp of the alternative medicine people who do yoga and Ayurvedic and traditional Chinese medicine and all kinds of other things. Some of them have evidence to support them, and some of them don't have so much evidence to support them. And by and large, these people don't trust each other. How do you manage to combine them?
Well, carefully, I guess, is the word. So what I tried to do was to choose safe, holistic treatments that address the various aspects of mind, body, and spirit that conventional medicine tends to neglect. And I erred on the side of choosing things that were very safe and had very low potential to interact negatively with any of my conventional cancer treatments. So that was kind of how I set it up. I didn't use a lot of dietary supplements, for example. I didn't use a lot of megadose vitamins because those are actually what I call alternative reductionist treatments. It's the same principle as a drug. You're trying to somehow goose a biochemical pathway in the body to make some change that helps you. That's reductionism. Holism, on the other hand, is this idea of doing things to improve your posture, improve your breath, improve your sleep, balance your nervous system better. And this is, of course, what yoga is wonderful at and what Ayurveda is wonderful at. So the idea was I was doing the mind, body, spirit stuff, and that does include bodily stuff, and that does include things that could potentially even improve the outcome from the cancer. But I was also doing stuff to relax me, to make my nervous system better, to theoretically help my immune system function better, etc.
Should we all be looking at combinations of different therapies when we're faced with a health crisis like a cancer diagnosis.
And the idea of holism is that even if you don't have any diagnoses right now, we can improve your posture. We can improve your breath. We can improve the balance of your autonomic nervous system. We can improve your sleep. We can improve the function of your immune system. In Western medicine, we try to take people from being sick to bringing them back to having no symptoms and having normal lab tests. In yoga therapy, in Ayurveda and traditional Chinese medicine, we're trying to take you from sickness or health to thriving and fulfillment and a deeper level of engagement in your life and well-being than Western medicine ever touches.
You write in the book, conventional medicine handles disease the way conventional agriculture handles crop pests. Excise and poison the invaders until they've been killed off. Holistic medicine, on the other hand, resembles organic gardening. Nurture the soil in which your plants grow, and your plants will be healthy. Can you follow up on that a bit, please?
Sure. I think we have made a big mistake in society. We have divided up healthcare into conventional medical care, scientific medicine, whatever you want to call it on the one hand, and alternative or complementary and alternative or integrative on the other hand. And I think a lot of times which camp a therapy winds up in is a little bit arbitrary, subject to politics, subject to financial incentives, subject to historical flukes. The real difference, I think, is between reductionism, things like drug therapy, again, designed to tweak a biochemical pathway, or holism, designed to improve the body, mind, and spirit of the person with the disease. The treatment is not aimed at the disease. The treatment is aimed at you and making you better, make you sleep better, make your posture better, make your breath easier, balance your autonomic nervous system better, with the idea that if you're strengthened in that way, you're going to be able to cope with whatever disease you have. And it doesn't matter what disease you have. These holistic principles work for anything, potentially.
You're listening to Dr. Timothy McCall. He's a board-certified internist who has been Yoga Journal's medical editor since 2002. His books include Examining Your Doctor, A Patient's Guide to Avoiding Harmful Medical Care, Yoga as Medicine, and his most recent, Saving My Neck, A Doctor's East-West Journey Through Cancer. Dr. McCall teaches yoga therapy seminars in the U.S. and around the world.
And Terry, I think it's kind of interesting, this idea of a reductionist approach versus a holistic approach. Drugs are very good at affecting molecules and certain systems in the body. We have anti-everything, antibiotics, antidepressants, antacids. But, sometimes it's useful to think holistically as well.
It can be very helpful.
After the break, we'll find out how Dr. McCall's oncologist reacted to the holistic approaches he was using.
He found that fasting and a ketogenic diet reduced the nausea caused by chemo.
What other modalities did he utilize?
Dr. McCall found a simple way to apply hyperthermia by soaking in the hot tub. What does hyperthermia do? You're listening to The People's Pharmacy with Joe and Terry Graydon.
This People's Pharmacy podcast is brought to you in part by Verisana.com.
Verisana Lab offers home health tests that allow you to monitor your hormones and health conditions. You can take control of the quantitative assessment of your health and learn about male and female hormone balance, the stress hormone cortisol, leaky gut, gluten intolerance, or your gut microbiome.
Take a more active role in tracking your health and take 20% off your first order of a mail-in testing opportunity with the discount code PEOPLE. That's uppercase PEOPLE. To learn more, go to Verisana.com. That's Verisana.com.
Welcome back to the People's Pharmacy. I'm Terry Graydon.
And I'm Joe Graydon. To purchase a CD of today's show or any People's Pharmacy broadcast, you can call 800-732-2334. Today's show is number 1175. That number again, 800-732-2334, or you can find it at peoplespharmacy.com. You can also download the free podcast from Apple, Stitcher, or from our web store. We invite you to consider writing a review.
The People's Pharmacy is brought to you in part by Kaya Biotics, probiotic products made in Germany from certified organic ingredients. Kaya Biotics.com.
Can conventional cancer treatment be combined with complementary and alternative medicine? How do oncologists react to this concept?
Our guest is Dr. Timothy McCall. He's a board-certified internist who has been Yoga Journal's medical editor since 2002. His books include Yoga as Medicine and his latest, Saving My Neck, a doctor's east-west journey through cancer.
Dr. Tim McCall, you went through a pretty rigorous conventional treatment approach with both radiation therapy and chemotherapy, and you were doing some other things on the side, not the least of which, of course, was yoga. How did your oncologists respond to the other things that you were doing?
Well, they didn't know about everything I did, partly because when I first started sharing with my oncologist that I was planning on doing some very gentle herbal treatments that I had researched pretty heavily. In that month I was in India before I began my cancer treatment, I read an integrative oncology textbook cover to cover. I read hundreds of articles. I read everything. I read conservative books and fringe books and everything in between to try to help me make these decisions. They weren't terribly interested in what I was doing, except when I told them that these herbs I was hoping to take, very low doses, ones that had been shown in studies to not interact negatively with chemotherapy. My oncologist just rejected it out of hand. She told me, I don't want you doing any of this stuff. And again, I'm a strong patient. I'm not going to be dictated to that way. It's not like I didn't know what I was doing and hadn't done my homework. And I decided in that moment that she had lost her right to be fully informed of what I was doing. So I only told them about part of what I was doing. Not an ideal situation, mind you, but they weren't really going to understand it anyway. So mostly they just kind of knew I was doing some stuff, didn't know too much about it. One of the biggest things I did, by the way, was I fasted. And I had read some studies that suggested fasting could potentiate the effectiveness of both chemotherapy and radiation and greatly lower the side effects. And this was enormously effective. I was on cisplatin, which is a terrible drug as far as nausea and vomiting goes. And because I fasted for about 48 hours before each infusion, I had no nausea and vomiting. My doctors were amazed. They didn't even know why, and I didn't tell them until after I was done.
That is amazing.
So you had read that fasting could be helpful. You did the experiment, and you found that it was, in fact, super helpful.
It was super helpful. It appeared to be super helpful in reducing my symptoms. And, I never had any chemo fog, that kind of fogginess of cognition that many people get with chemotherapy. I had no nausea and vomiting. And, of course, there's evidence that, but this is evidence from mice, that when an animal is fasting, that the chemotherapy is more effective and the radiation therapy is also more effective because the cancer cells are deprived of their normal source of nutrition, which is sugar, because you're fasting. And so their they're stuck in high energy mode. And so when you're fasting, they're under duress and then potentially more susceptible to the effects of the chemotherapy and radiation, whereas normal cells go into famine mode, a kind of shutdown self-protective mode that makes them more resistant to the negative effects of the treatments. And so I extrapolated from animals. Again, not an ideal situation, but unfortunately there have been no good controlled studies of fasting. Part of the problem is who's going to pay for them? Because, as you know, most research these days is paid for by industry. And the only one who profits when you fast potentially is you.
Right. What other modalities were you using?
Well, I had read some research just before I began treatment that acupuncture can improve salivary function. One of the major side effects of head and neck radiation is that you can dry out your salivary glands and have difficulty with a dry mouth and digesting your food well. It can be so bad that your mouth becomes more acidic and your teeth all rot out despite your best efforts at dental hygiene. So I was quite worried about that possibility. And when I read the studies that suggested that acupuncture could help, I really, just starting actually the day of my first treatment, I went for my first acupuncture treatment and got it 3 times a week during my treatment and for several weeks into my rehab after finishing treatment. And so that was one of the things I did. Another side effect that can happen sometimes much later but can be devastating is fibrosis, a kind of stiffening of all the tissues of the neck. It can lead to pain and difficulty swallowing and all kinds of other things. And so I did a type of body work called myofascial release, which was tremendously effective in increasing the range of motion in my neck and relieving some of the stuckness, some of the scarring of the tissue that resulted from the treatment.
Dr. Timothy McCall, what about hyperthermia? I noticed that was something you also included in your practice.
And that was a bit just due to the circumstances that I found myself in. So hyperthermia is an alternative treatment for cancer. There is some scientific evidence to support it, the idea of warming tissues of the body. It appears that cancer cells may be more subject to being harmed by higher temperatures than normal tissues in the body. And so there are various techniques of heating tissues. Now, I didn't have access to any of those where I was getting treated. But my brother and sister-in-law had a giant hot tub in their backyard. And it was the kind of thing that was hot enough that you had to wade into it slowly. So it was pretty darn hot. And basically, my metastatic lymph nodes were right beneath the surface of the skin. And so I figured, oh, what the heck? Let me just go in and I actually got a couple of 10-pound barbells that my nephew had in his room, and I held onto those to keep my neck just submerged and in the hot water, and I started staying about 20 or 30 minutes every day just with the idea that it might help. Now, did it really help? Who knows? But it relaxed my muscles. It made me feel good. I even chanted some healing mantras from yoga while I did it, which, yoga says helps. Maybe they help, maybe they don't. But my attitude was, look, this stuff isn't going to harm me. It might help me. Why not?
You mentioned herbs, and I suspect a lot of our listeners, whether they're dealing with cancer or not, would be interested in which herbs you determined would be safe. And I also would like you to talk a bit about mushrooms.
Sure. So now I should say that I am not an herbologist. I don't have particular expertise in this. I'll tell you what I did. But one of the things I say in the book, I'm trying to show people in the book how a truly holistic-minded physician went about making decisions. I'm not recommending that people necessarily do what I did, okay? It's more to try to open up the thinking process so that if people go through their own process, they'll kind of have perhaps a different way of understanding how to approach these decisions. Because the fact is, there's a lot of uncertainty. So I took a very low dose of ashwagandha, which is an herb that comes out of Ayurvedic medicine. I took astragalus, which is comes from the world of traditional Chinese medicine. I took, as you mentioned, some medicinal mushrooms, which are said to improve immune function. There was some evidence that HPV, the virus implicated in my cancer, was sensitive to certain, for example, black raspberries were apparently very good at suppressing that virus. So I added a little freeze-dried black raspberries to the mix. No evidence of any of this stuff. Just knowing that these things were safe, very unlikely to interact negatively. And I describe in more detail what I did in the book, but again, I wouldn't be writing this down and saying, I want to do exactly what I did. It was just, my idea was if I could strengthen myself and attack the cancer from as many angles simultaneously as I possibly could by improving my diet, by fasting, by doing body work, by doing yoga and Ayurveda, by doing traditional Chinese medicine, to kind of just come at it from all these different angles, that there was some chance of kind of a healing synergy, an additive or even multiplicative benefit of these different interventions.
And Dr. McCall, I'd like you to emphasize that one more time. You weren't choosing to do Ayurvedic medicine or body work or some other alternative medical therapy instead of conventional cancer treatment. You were actually combining them. How important is that?
Well, I think in this case it was very important because there is evidence, certainly in some people at least, that cure is potential with the conventional treatments. But the problem that they're starting to recognize is that these treatments have long-term side effects. So you might live for 30 or more years after you're cured of your cancer with rotted teeth and a dry mouth and pain on swallowing and food tasting funny and all this other stuff. And so part of the reason I came up with the idea of saving my neck was I realized that I'm not just trying to save my life here. I'm actually trying to save my neck. I'm trying to get my swallowing to continue to be working and my taste buds working and my salivary glands to the extent possible working. So that was really my approach. And so it wasn't about rejecting conventional medicine. It was to some extent about reining it in. About not because there is a tendency sometimes in conventional medicine, I believe, to do too much, to have the kind of idea that when in doubt, do something. And sometimes when in doubt, just waiting a little while and choosing a different strategy may be a more prudent method. So I didn't want to dismiss conventional medicine entirely, but I wasn't completely just going that route. I wanted to take the best of both worlds with the idea that, for example, say the fasting I did really potentiated the effect of the chemotherapy and radiation. Well, then maybe I can get it by with a little smaller dose because I'm doing other things that are making that little smaller dose more effective than it otherwise might have been.
How well did the acupuncture work as far as the salivary glands, and how are your teeth doing these days?
Thank you for asking. Well, one of the things about doing 12 things simultaneously is that sometimes you're not really sure which thing is having the effect, So I have much better salivary function than most people in my situation have, apparently. I've never needed anything, any kind of things to moisten my mouth or anything like that. I do need to drink a little more fluid with meals. Sometimes when my mouth feels a little dry, I found a little trick where if I just chew gum, that seems to bring the juices out quite nicely. But I'm not quite normal. But food tastes normal. My swallowing is fine. My energy and strength are good. In fact, as seen holistically, I'm now in much better health than I was before I got the cancer.
Well, that's what everybody wants to know. How are you doing today? What's the status of your recovery?
Well, of course, with cancer, on some level, you never know. But as far as I know, I'm, as I said, in the best health I've probably ever been in. So, I think there's a lot of times when people go through cancer, they're just trying to get back to their life, what it was like before they got cancer. And what I tried to do instead was try to bring myself to a place of balance and health that was better than it was before I got cancer. And I think, by and large, I've succeeded. And I have to say that I continue to show improvement. And I saw a friend last week for tea, and she hadn't seen me in a year, and she said to me, "You look great. You look better than you did a year ago, and you look actually the best I've ever seen you." And that's how I feel.
And what would you like to share with our listeners in terms of yoga? How has your practice of yoga and your teaching of yoga evolved over the years?
Well, I think one of the things that's happened to my yoga over the years is that it's become softer and more firmly grounded in the breath. I started doing yoga for many years. It was very heavily alignment-based, about anatomical alignment of the bones and muscles in the body. And I still think there are valuable lessons to be learned from that. But now I think what I do is try to slow and smooth the breath, because I've learned, and again, we didn't get into it in this interview, but I had some pretty significant trauma early in my life that left my nervous system pretty hyper-reactive. And so I found that the slow, smooth breathing and the very kind of mindful, slow, almost like Qigong or Tai Chi-like action, which I now do in my yoga practice, I find this is actually serving me better than the little bit fiercer, more alignment-based stuff I did for another years. Now, that stuff works too. That stuff brought me to where I was, and I had all kinds of improvement from that, but I'm finding that this serves me even better.
Dr. Tim McCall, what would you like listeners to take from your book, Saving My Neck, A Doctor's East-West Journey Through Cancer?
I'd really like them to understand that a lot of health and healing is in their own hands. Now, the downside is that you got to do the work. But if you're willing to do that work, it can take you much farther than conventional medicine by itself ever would.
Dr. Timothy McCall, thank you ever so much for talking with us on the People's Pharmacy today.
Thank you. It was really a pleasure.
You've been listening to Dr. Timothy McCall. He's a board-certified internist who's been Yoga Journal's medical editor since 2002. His books include Examining Your Doctor, A Patient's Guide to Avoiding Harmful Medical Care, Yoga as Medicine, and his latest, Saving My Neck, A Doctor's East-West Journey Through Cancer.
Lynn Siegel produced today's show. Al Wodarski engineered. Dave Graydon edits our interviews.
The People's Pharmacy is produced at the studios of North Carolina Public Radio, WUNC.
The People's Pharmacy theme music is by B.J. Liederman.
The People's Pharmacy is brought to you in part by Verosana, an analytical laboratory providing home health tests for hormones, gut health, and the microbiome. Online at verisana.com.
If you'd like to buy a CD of today's show or any other People's Pharmacy episode, you can call 800-732-2334. Today's show is number 1175. That number to call, 800-732-2334, or you can place the order on our website, peoplespharmacy.com.
When you visit our site, you can share your thoughts about today's show. Have you ever integrated conventional and complementary therapies for a medical condition? Please share your story.
At peoplespharmacy.com, you can sign up for our free online newsletter or subscribe to the free podcast of the show. Don't miss any more episodes. You can share it with a friend.
And when you sign up for the newsletter, you'll get our free e-guide to favorite home remedies. In Durham, North Carolina, I'm Joe Graydon.
And I'm Terry Graydon. Thanks for listening. Please join us again next week. Thank you for listening to the People's Pharmacy Podcast. It's an honor and a pleasure to bring you our award-winning program week in and week out. But producing and distributing this show as a free podcast takes time and costs money. If you like what we do and you'd like to help us continue to produce high-quality, independent healthcare journalism, please consider chipping in. Even a small donation can make a big difference. All you have to do is go to peoplespharmacy.com/donate. Whether it's just one time or a monthly donation, you can be part of the team that makes the show possible. Thank you for your continued loyalty and support.